This webinar is to provide you with an answer to anyone who's ever said that natural health care is unscientific. It's actually more scientific than medicine, and we're going to demonstrate why. I'm Dr. Paul G. Varnas. There's my email. Happy to communicate with you. I've started a site called drvarnas.com, which is full of scientific information supporting what we do. And by way of disclosure, I work with Zorex International. They're a great company. They're the young, plucky startup. A lot of the companies that I've dealt with in the past are now big corporate entities. Nestle owns a couple of the ones that I used to use regularly. This is an independent company. They've got very high quality, very intelligently designed products. Give them a try. Really quickly give you my background. I grew up in a chiropractic family. I've 36 years. I've had an all cash, all referral practice. I've taught nutrition at the National University of Health Sciences, and I've been studying the literature intensely for the last 20 years, actually my whole career. And I write. You may have seen the Better Health News. I've written a couple of books. I've even written fiction. In fact, if you can look up Revolution Time on Amazon.com, I'd appreciate it. I have a second website, wholehealthweb.com, which is full of research supporting natural health care. If you have a chance, take a look at wholehealthweb.com. I'm adding new material all the time. The purpose of this series is healthcare in the United States is too expensive. It's $3.7 trillion a year, 18% of our GDP. $1 out of every six goes to healthcare, and it's too much. And you probably already know that we are the answer. We're much cheaper, we're much more effective. We have a medical system that seems to make chronic people sicker. Okay, but we need to have better communication. We need to be talking science. If you're going to attract people from the medical model, talk science. Don't talk energy. Don't talk things that you do in your office that may work, but really haven't been proven. It's okay to do those things, but when you talk, make it make sense to the average layperson because they're very locked into the medical model. And then also you want to do therapy that works and covers the basics and has some science behind it. A lot of us are doing very esoteric things with our patients and they help somewhat, but it's really, really a good idea to do the basics first. And the next webinar in this series is about treating inflammation, and I think everybody should see that and incorporate some of those ideas into their practice. And the reason this particular webinar is being done is so that we can communicate and show the rationale for the therapy we're doing, even if it's not something that's quote unquote been proven in a lab. Okay, but we need to express what we're doing and we need to get back to fundamentals. Natural healthcare is very different from medicine. We don't really treat disease, we fix infrastructure, and I'll get into that a little bit later. The other problem we have with attracting patients is a patient's going to walk into a building that says store, okay, and they have no idea if you're doing energy, especially like I'll talk about chiropractors. You know, you got the hole-in-one guys, you got guys that are doing functional medicine, there's all kinds of different techniques, and when a patient goes there, they have no idea what they're walking into. And I think if more of us did basic nutrition and fixed infrastructure, and if we did other things on top of that, it would be easier to get more of the public to come to us. In Mein Kampf, Adolf Hitler coined the term the big lie. It's a lie so big that no one believed that anyone would have the impudence to distort the truth that way. And that is my segue to the concept of medical science with quotes around it. Richard Smith, former editor of the British Medical Journal, criticized this publication, saying they were too dependent on advertising revenue to be considered impartial. 1/3 of the studies published in that particular journal are funded by the pharmaceutical industry. So how can you have independent science when you got a corporate entity and they advertise in all the journals? Richard Horton, editor of The Lancet, put it a little more strongly. He said, journals have devolved into information laundering operations for the pharmaceutical industry. Clinical trials published by the journals are a bigger problem. These are funded by the pharmaceutical industry, and they're another source of income for the journals because they sell reprints. And we know how well some of these studies are. Look at the opioid studies. They fudged their results, got them published, did all kinds of marketing, And now we have an opioid crisis because of basically lies from the pharmaceutical industry perpetrated by the medical journals. So in general, 2/3 to 3/4 of the trials published in major journals are funded by the pharmaceutical industry. Okay, and these are money makers. And if you're making a lot of money from the pharmaceutical industry, how likely are you to say something non-drug is going to be a good therapy? So when a journal publishes a trial from the drug industry, it's worth upwards of $1 million in reprint costs. Okay, this is big money for them. This is their reason for being. So how are they going to go against anything that the drug companies say? And of course, the journals with the most advertising from the drug companies had the fewest articles about nutritional supplements. Surprise, surprise. Okay, and they tend to be negative. So this Israeli journal of psychiatry-related science points out all this activity, trials and all that, is more about marketing than it is about clinical considerations or science. So as a result, we have multi-billion-dollar corporations controlling our observations and our conversations about health. That's not scientific. And it is a big reason why we're spending $3.7 trillion in healthcare. I mean, how much has the opioid crisis cost us? Okay. And we are the answer. But we got to keep it simple. We got to keep it with science. Do the basics first, and that's what my websites are about. Hopefully, I'm not against doing different things because a lot of that stuff works. I do applied kinesiology. What can I talk about? But we need to talk science when we talk to our patients. And I'm getting really tired of being called unscientific. Not proven in the lab does not mean unscientific. If you look at scientific method, okay, first you make an observation, and then you pose a testable question based on that observation. Then you state your hypotheses. I mean, take something like muscle testing. Okay, I made an observation, I tested a muscle, something changed. And then I'm asking myself, does this mean something about the patient's health? Is there an organ related to that? That's scientific, okay? It hasn't been proven in a lab. And I could be wrong, okay? I'm still working in a hypothesis, okay? But after that, then you design and perform an experiment, collect data, and draw a conclusion. Okay, number 4 is what medicine says all of science is, but they ignore the first 3 steps. Medical science is to science what cherry-flavored Kool-Aid is to cherries. Okay, they ask crappy questions. You got those first 3 steps. That's where they fall down. Okay, they ask things like, will Damodol reduce diarrhea in patients with Crohn's disease? Okay, it's a really stupid question. It's one set of chemical reactions, one result, and it'll sell Damodol, but it really doesn't do much for the cause of the problem. It's all about supporting a patentable treatment. And there are a bunch of observations that medical science, quotes, has ignored out of hand. CoQ10 and heart failure. If a drug did what CoQ10 does for heart failure, it'd be on the cover of Time magazine if someone owned a patent. Okay, magnesium and asthma, same way. The microbiome. There's all these little studies going around, but it really hasn't broken into the mainstream, and none of the journals focus on it. Inflammation and heart disease. We're talking about cholesterol, cholesterol, cholesterol. Inflammation, CRP, is a much bigger deal. Okay, lipoic acid and diabetes. Every diabetic should be on lipoic acid when you see the research behind it. It helps prevent neuropathy. Okay, these are things that are basically ignored in our healthcare system. So you might be doing something in your office and it'll be dismissed by the medical people as anecdotal. But anecdotal is not meaningless. It means that most of us are making an observation and developing therapies based on that observation, noting if the observations are significant. Okay, back to Crohn's disease. Okay, they're looking to see if Damodol gets a little bit of an improvement, and we're asking questions like, oh, is it caused by a bug? Is it caused by an allergy? Is there an amoeba involved? Is there, lots? We're looking at different mechanisms. We'll try a therapy that is a low risk, high gain therapy and see if we get a result. Okay, we're looking at the mechanisms. This is much more scientific. And most of our therapies do not present any dangerous side effects, so we could be trying things in our office. It's completely legitimate from a scientific perspective. So natural healthcare revolves around identifying physiologic processes that have gone wrong and how they relate to disease. Okay, we're trying to improve the physiology. We don't really treat disease. We're fixing infrastructure. So not proven does not mean not scientific. I mean, colleagues are getting results with muscle testing. Stomach HCl, there's very, very little in the literature about that. The use of glandulars used to be big in the 40s and 50s and has since fallen out of favor. Pulse testing. If you do pulse testing, don't tell them that you're finding an allergy, but there is a couple of studies that say if you find a food that increases the pulse and remove it, you do get some clinical result. But it's not allergy testing. Neurolingual testing the same way. You find a sore spot, you have a person put something in their mouth, the sore spot gets less sore. You're testing an idea. So we need to watch what we say. We got to avoid assertions that have not been proven. Things like pulse testing or basal body temperature for thyroid. We find a low temperature does not mean hypothyroidism. Okay, and we got to be careful with the word treat. For instance, magnesium. If you give an asthmatic magnesium, chances are they're going to improve a lot. But the magnesium doesn't treat asthma, it treats a magnesium deficiency. It just turns out that a lot of asthmatics are deficient in magnesium, so they experience an improvement when you give it to them. So we have things that are supported by studies and things that are not. If you go to either of my sites, wholehealthweb.com or drvarnes.com, I've tried to sort those things out for you. But for example, HCl supplements, glandulars, not a lot of proof, okay? Magnesium and berberine for insulin sensitivity, lots of studies. Enzymes for inflammation, lots of studies. Carotenoids and polyphenols for inflammation, lots of studies. Those are well supported. And when you're talking to your patient, talk about those things. This is a model created by Emmanuel Shiraskin in his book Predictive Medicine, and it really nicely explains what we're doing, and it explains health and disease in a really nice way. Basically, if you have all the components of health, good diet, good structural alignment, biorhythmic integrity, not being exposed to toxins and so on, you're healthy. If something is not right in the center here, then you start having problems with your enzyme function. If that continues, eventually your hormones get involved. If that continues, you start having general biochemical problems. Now understand, things can go wrong all through here, and you still might not have any symptoms or signs. You might not even know there's a problem. But eventually you get into physiologic performance. Physiologic performance can be wrong, and that a lot of times that's the patient who's going from doctor to doctor. Something's wrong. The doctors can't find anything. They run tests. Now you guys will find things because we have other ways of looking, and we are looking at subtle physiological signs a lot of the times. That's why a lot of times we'll find a problem, we'll fix it, even though the doctors say, oh, there's nothing wrong. Okay. Eventually, there's signs and symptoms. Now medicine can be active in it. So say you eat a crappy diet. Eventually you start having problems. Your health is less than perfect. It goes on for a while and your enzyme systems aren't working well. For instance, you're eating nutrient deficient food, processed food. All of a sudden you're a little low on zinc, you're a little low on magnesium, you're a little low on B6. Those are cofactors for enzymes, so things don't work quite right. Eventually the hormonal system gets involved. For instance, you're eating a lot of sugar and you start having problems with your adrenal hormones, you start having problems with insulin. Eventually, biochemical problems become more widespread. So you start having a lot of little things going around throughout the body. Then you start having problems with physiologic performance. I don't have as much energy as I used to. I used to want to do things and now I don't. Gee, I'm kind of sore, I'm stiff when I get it, whatever. No identifiable disease. But eventually you have signs, which are laboratory findings, and then you have symptoms, which are actually, okay, now you have diabetes, now you have a disease that we can name, you have asthma, whatever. Okay, and medicine works out here. They manipulate the symptoms. Okay, we're working in here. We're fixing infrastructure. We might even give some enzymes to help. But what we're trying to do, we're not treating the disease. We're trying to make this big black blob shrink and pull away from the signs and symptoms. So in natural health care, our therapy is not about the symptoms. It's about fixing the infrastructure. That's why we can do many different therapies for the same thing. You give 4 different drugs for a problem, you're going to start having problems. So when you give magnesium and anti-inflammatory stuff to an asthmatic, you're not really treating the asthmatic. You're fixing the infrastructure. Our next webinar is going to be about inflammation. And inflammation is a component of every disease. Finding and treating inflammation is the health equivalent of making sure you have gas in the tank or the battery's charged or the car's in park. It's the simple thing. And a lot of times, if you simply address inflammation, you don't have to do anything fancy. Inflammation is a component of every disease, including cancer and heart disease. So if you have someone with heart disease, or you have someone with cancer, you can address their inflammation. You're not treating the cancer or the heart disease. You're building infrastructure. And there's my information. I'm happy to help you. Contact me. If you call me, you probably get a recording, but I'll get back to you. I'm happy to do anything I can to help your practice. If you go to drvarnes.com, I've got materials there even to help you market your practice if you need that. Wholehealthweb.com has scientific information. Please give Zorix International a look. You can get a free copy PDF of clinical insights from them. This is Dr. Harry Eidner giving you tips on how to fix all kinds of things. He's brilliant. And there's their contact information. Contact them. Go to their website, zorixinternational.com. Their products are very intelligently designed. It's an independent company, which is a good thing, and very innovative. Thank you.